On July 30th, 1965, Medicare was signed into law by President Lyndon Johnson. That's been almost 60 years ago now, and my, how things have changed. And sadly, many of those changes have not been the best. In this video, I'm going to explain to you those changes, as well as the confusion, the corruption, and the chaos that exist in Medicare today. I want to begin with just a quick history of the Medicare program over these last 60 years. Of course, it did begin in 1965, signed into law by President Lyndon Johnson. And then in 1966, the program was implemented. The first cards were issued to President Harry Truman and his wife, Bess. And then at the same time, that's when Medigap plans were launched. There were just a couple of them, but we've had them ever since the inception of Medicare. They still, of course, exist today. And then in 1997, some 30 years later, there began to be some changes. Private health insurance companies began to get involved in the Medicare space. And so we have the passing of the Balanced Budget Act. And with that, then the Medicare Choice Plans were then introduced. And of course, later that would change. And then in 2003, they would change those by name. And now they're called Advantage Plans. So Advantage Plans now have been in existence for a little over 20 years. And then in 2006, Part D benefits began. Medicare didn't cover self-administered medications until 2006. They covered meds that were inpatient, outpatient, but not self-administered meds. And so actually in 2003, that idea was introduced. It took them a couple years to get that together. And then ever since 2006, we've had Part D coverage for our self-administered medications. So that's kind of the history. Now let's look at Medicare today in 2024. First off, of the Medicare population, which consists now of about 70 million people on Medicare today, 10% of them actually just simply have A and B only. They opted for no other insurance. I don't think this is the best choice, but again, 10% of all people do this. The reason I don't like it is because there's so much financial liability if that's all someone has today. Now, the second option that people have chosen today is to enroll in traditional Medicare A and B. They pay first, and then they get a supplemental plan to fill in those gaps. The reason I don't like this option is because there are some serious gaps. There's 3 gaps on the A and 3 gaps on the B. So in this scenario, you're responsible for all those financial gaps because Medicare only pays for one thing 100%, and that's preventive care. That's it. So if it's not preventive, now you're going to have a balance of the bill. So people that don't want to have the balance of the bill, that liability, they will get a supplemental plan to cover those gaps. And so right now in the present market, we actually have 10 different supplemental plans. These are all standardized by Medicare, which means regardless of the carrier that you go with, the coverage medically is going to be the same. And so there are 10 letters. They are called Medicare Supplemental Plans A, B, C, D, F, G, K, L, M, and N. Now, if you're born after January 1st, 1955, starting Medicare after January 1, 2020, those 10 are not your options. You can only choose 8 because there's 2 plans today that are only available for those that started Medicare before January 1, 2020, and that is Plan C and Plan F. But if you're born after that, those wouldn't be available, so we have one of the 8 letters available. Now, again, I'm not going to get into all those other than to say that the majority of people, probably 99% of all people today, are buying either the Plan G or the Plan N. Those are different letters, which means different coverage types, but those are your 2 top plans. They say right now that of all people buying the supplemental plans, 70% buy G and 30% buy Plan Ns. And what are they doing? They're buying that plan to cover the gaps that Medicare has made them responsible for. You cannot get rid of all the gaps, but you can get rid of most of the gaps with those supplemental plans. But the point is, these are people that stay in the traditional Medicare system and get help financially with the supplemental plan. Of course, they got to pay a premium to the supplemental plan to take that liability. And then the third option today is, again, the Advantage plans. We saw they were originally Choice plans in 1997, and then in 2003 they were named Advantage plans, so they've been around a little over 20 years now. So this is what's called a replacement plan. This is now a private health insurance company, a commercial insurance company that is now responsible for you. They call this coordinated care. If I'm up in here in A and B with a SUP, it is the government insurance that is dictating everything, the government guidelines and rules that dictate that kind of care. Here, now I have a private health insurance company that is in charge of that care. And again, now just a little over 50% of all people are enrolling into Advantage plans. So that's kind of the scope of how Medicare is being used today. Now we're going to get to a question that we posed in this whole video, and that is, what the heck has happened. Medicare has been around now almost 60 years, and it has changed drastically. And again, some of those changes have been very detrimental to Medicare recipients. All right. And so what I want to do is I want to show you what I would consider to be the three big issues that are now really impacting Medicare and Medicare beneficiaries. The first one is this. Today in Medicare, it's all about the profit instead of the patient. In other words, it's all about how much can the insurance company make and how much can the insurance agent make. It's all about that instead of the patient. When Medicare began in 1965, the sole purpose was to make sure that people in their later years, 65 and beyond, were going to have their health insurance covered, because they said in that day that 40% of all people could not afford health insurance in their retirement years. So that is the reason Medicare began. And today, it's not all about that. Today, it's not about the patient. It truly is about the profit. Hey, if you found this video helpful and you want to see more Medicare information just like it, then go below, right below the video, and you can give us the thumbs up as well as subscribe to our channel. And every time I put a new video, which is about 2 every week, you'll be notified of that video, and others just like you who need this vital information will get it as well. I want to read just a quick article to you that I found that I think really summarizes the situation today very, very well that's going on in Medicare, and specifically about the Advantage plans. This is written by a doctor. Her name is Dr. Jung. She's a gastroenterologist, and here's what she said. When patients are suffering from life-threatening illnesses or debilitating health conditions, the only thing that should matter is delivering appropriate evidence-based treatments in a timely manner. Patients rightly turn to us, she says, their trusted physicians, for expert guidance on the best course of action. Yet all too often, now listen to this, yet all too often, insurers insert themselves into the equation. Now, may I stop here for just a second? If someone has a supplemental plan, that insurance company can never insert themselves into the equation. If Medicare pays, the supplemental plan has to pay, no questions asked. But when someone enrolls into an Advantage plan, what happens? That Advantage plan has the right to insert themselves into the health equation. So let me say it again. Yet all too often, she says, insurers insert themselves into the equation. As a result, restrictive policies like prior authorizations can interfere with patient care and lead to dangerous and painful outcomes. And that's what I'm saying. The problem today is all about the profit of the insurance company. Why? Because when someone enrolls in a plan, they don't realize they have now just given the control of their care to that private health insurance company. And as the doctor had mentioned, one of the biggest issues would be this, and that is pre-authorizations. They say right now that 70 to 72% of the services that people will need on their healthcare plan, on the Advantage plan, is going to have a pre-authorization. It's going to have to be a pre-approval, which means what? It's something that is expensive. It could be a CAT scan, an MRI, a PET scan. It could be an inpatient surgery, an outpatient surgery, knee replacement, hip replacement. It could be an extended skilled nursing stay. But anything that's going to be more expensive than just a primary care doctor visit or some basic lab work typically is going to have to be pre-approved by the insurance company, which means what? Doctor with the Advantage plan only makes a recommendation. That doesn't mean you're going to get that service. What happens is the doctor makes a recommendation, asks for a pre-approval. That information is given to the insurance company. Right now, they have up to 2 weeks for an authorization. The government's going to bring that down to a week, but they have plenty of time where they can evaluate that to see if they really do believe that the patient needs that. So doctor recommends, the insurance company has the right to approve it. And sometimes they do, but sometimes they don't. Sometimes they delay care. Sometimes they will flat deny care. And so that's the whole issue today. What are companies trying to do? They're trying to make their profit. And truly, tens of billions of dollars are being made today by these private health insurance companies. And one of the way they make their money is by restricting the care through this process of pre-authorizations. And so this has become a major problem today in Medicare that did not exist when it started in 1965. I just want to read some other articles to you that I hope will really shed some wonderful light on this. This actually came from a group that was meeting just recently, and it's called MedPAC. It stands for the Medicare Payment Advisory Commission. And they had a meeting, and of course a long report. I just want to read a couple things here, but there were many in the meeting that chimed in with a wide variety of frustrations that they've heard about Medicare Advantage from providers and patients dealing with this. Listen, narrow networks, prior authorization practices that delay or deny care, and extravagant broker commissions that result in steering confused seniors into plans without their understanding of what they might be giving up. They go on to say, according to the reports, 31.6 million people are now enrolled in Medicare Advantage plans, a fact that prompted many commissioners at this meeting to note a sense of urgency that aspects of the Medicare Advantage program have gotten out of control. One commissioner said this: "The reason I feel a sense of urgency is we keep coming back to this issue that Medicare Advantage plans have never yielded aggregate savings to the Medicare program as promised back in 2003, despite that being one of the core goals." They also went on to say, this Medicare Advantage plan is not the big, lovely, glowing success that everybody says it is, and we continue to create policies that drive people into these plans. We've allowed the Medicare Advantage to buy the market, and that is why Medicare Advantage is growing. It's not because the quality is so great. People don't love their prior authorizations. People are leaving their plans a lot. They went on to saying that while policy experts maintain that MA plan growth is propelled by patient preferences, the real reason may be because of brokers who are pitching the plans to their clients. So let me explain what I mean by that. When someone makes a decision to get an Advantage plan, they're normally not doing this alone. They're normally being helped by some kind of an agent. And so, by the way, I'm an agent. I'm an insurance broker. And so here's what happens. We truly get double the commissions when it comes to Advantage plans. Double the commissions than what we would make if someone got a supplemental plan. Not only that, we also, as long as that patient stays on that particular plan, enrolled in it, we actually get lifetime residuals, okay? So what's the motive? It's not just the profit of the insurance company, it's also the profit of the insurance agent as well. Now, just so you know, we as a company write Advantage plans because sometimes that is the best fit for people and in their particular situation, namely because they couldn't afford a premium for a good quality supplemental plan. But the problem is, what happens is so many agents today are pushing Advantage plans, again, because it's the most advantageous for them. But is it really the best for the client? And I think you'll see in this report that it is not. I want to just share with you a couple more things here. I have an article in my hand that says this: hospitals are dropping Medicare Advantage plans left and right. Left and right. Among the most commonly cited reasons for hospitals dropping Advantage plans are prior authorization denial rates and slow payments from insurers. One president of a hospital group in San Diego said this: "It's become a game of delay, deny, and not pay." He's talking about the Advantage plans. He says their group began notifying patients that they are terminating Medicare Advantage contracts within their group. It was going to actually affect 30,000 seniors in that particular region. And here's what he went on to say. He says, if other organizations are experiencing what we are, it's going to be a short period of time before they start floundering or they get out of Medicare Advantage. I think we'll see this trend continue and accelerate unless something changes. Let me just read one more. This came from a gentleman who ran a hospital group. He says this: "I feel terrible for the patients in this situation. It's the last thing that we wanted to do as a hospital group, but it's just not sustainable with these kinds of losses. Patients need to be aware of how this system works. Traditional Medicare is not an issue." That's what I was saying. A and B with a supplemental plan, never an issue. With these other models, seniors need to be wary and savvy buyers. Listen to this. Just in Nebraska alone, there was a detailed report that said Medicare Advantage is failing patients and jeopardizing Nebraska hospitals, 33% of which do not accept Medicare Advantage plans any longer. Okay, the report cited negative patient experiences, post-acute placement delays, and administrative and financial burdens on hospitals that accept Medicare Advantage plans. Just one more. This also is a very interesting report that just came out. I think I got this off the internet just a couple days ago. And here's what they said: hospitals, Medicare Advantage problems hits an inflection point. Just out. Here's what this said. This is a gentleman who's the president and CEO of the Federation of American Hospitals. And here's what he said: the relationship between hospitals and managed care, that's Advantage plans, is strained at best right now. Insurers are finding every way to not pay for the care that Medicare beneficiaries should receive. I don't know how this issue gets worse. We are at a critical stage. Seniors have seen their benefits get better every year through Advantage, but now we're at an inflection point and the free lunch is over. And you know about the free lunch. You see all the ads and all the things that they talk about with Advantage plans. He says there's going to be a sharing of the pain. Providers, this means hospitals and doctors, have disproportionately shared the pain, and now you're seeing many of them say enough is enough, we're out. And many of them today no longer taking Advantage plans. This is a report that just came out a couple months ago. It says at least 15 hospitals and health systems nationwide have dropped some or all of their Medicare Advantage contracts. Among the reasons most cited were excessive, again, prior authorizations, denial rates, and slow payments from insurance companies. One president and CEO of a hospital group said it's become a game of delay, and denial, and not paying. Providers are going to have to get out of the full risk capitation, that's Advantage plans, because it just doesn't work. He went on to say that they have lost $75 million because of the low-paying Medicare Advantage contracts. I'm almost done here. There was a survey recently, I thought this is so interesting, of 135 health system CFOs, Chief Financial Officers, which found that 16% of these CFOs are planning within their organizations to stop accepting one or more MA plans in the next 2 years. Another 45% of the CFOs said they're considering the same, but have not yet made a final decision. The same report said that 62% of all CFOs believe that collecting for Medicare Advantage plans have significantly become more difficult in the last couple of years. Medicare Advantage net reimbursement right now is terrible for hospitals. This hospital group leader said our clients average about 85 cents on the dollar, and it's only getting worse. Listen to this. He says Medicare Advantage is a race to the bottom, and I would argue that we've hit the bottom. Medicare Advantage denials, these are pre-authorization denials, increased almost 56% for the average hospital from July 22 to July 2023. He says we will ultimately pick a couple of partners going forward, a couple of Advantage plans, and I think a lot of health systems are going to do the same. He said they're going to be the partners. We want to partner with those who act like partners and not who deny care in order to bolster, listen, their billions of dollars of quarterly earnings. Now, this is the last thing I want to read to you here. This came from the former CMS, that's the Center for Medicare and Medicaid Services Director. His name is Don Berwick. Here's what he said. He said, the battle between hospitals and Medicare Advantage is a manifestation of an underlying broken system in which everyone that gives care wants to give more care, and everyone that pays for care wants to pay for less. And here's what he says. To me, the untold story yet is about the physicians and nurses who don't feel directly tied to ongoing Medicare Advantage trends, but they are certainly immersed in a changing financial landscape. And that's what I'm talking about. It's all about profit. It's not about patient care. And this is going to have an impact upon physicians and nurses and other providers. He says, as venture capital companies, private equity, and ownership of healthcare by private insurance increases, it changes their worlds. In other words, the providers' worlds. It changes what it's like to practice, their feelings about themselves, and degrees of freedom they have to care for their patients. That chicken is coming home to roost. And so my whole point is this. What's changed in Medicare? It's all about profit instead about the patient. And so what happens is these plans will actually put together networks. And these networks are going to be HMOs and PPOs. So what happens? Well, instead of a provider getting what Medicare is going to pay them for their services, now they have to have a contract with these private health insurance companies, either an HMO or PPO, and those reimbursement rates that they get are very low. And that's why fewer and fewer doctors and hospitals are taking these plans because of those reimbursement rates. They just simply cannot make a profit from them any longer. And so what's it all about? It's all about, again, the profit. So they control their profits by having networks, and they control their profits by you having to go through pre-authorizations. Now, the second big issue that's happened is this, and that is Medicare consumers, people enrolled into Medicare. What are they doing? They're chasing after perks instead of quality coverage. And we see this happen all the time because most people go on Medicare at 65 or thereabouts, and they're typically healthy, have no health problems. And so what they're really drawn to would be the different perks that Advantage companies offer. And so Advantage plans usually have some type of a gym membership that's included. It's called Silver Sneakers or Renew Active Network. They'll give them some type of a dental allowance. It may be $1,000, $1,500, but they have a dental allowance as part of that. They'll give them a vision allowance. That's typically about $250 a year. towards eyewear, credit towards eyewear, and they also will include usually some type of a hearing aid benefit as well. And so those are the perks that, of course, are very attractive to people. They also give what's called over-the-counter cards. So someone can go on once a quarter and order a certain amount of maybe $50 or $75 of over-the-counter items. They also typically include some kind of a Part D plan, a prescription drug coverage, and sometimes those are very good. But my whole point is we have all these perks that are now offered by the Advantage plans. Why? Because they're getting these excess dollars from Medicare, and so they make those perks available. I think in the future we're going to see those perks come back, but here's my point. People are chasing after the perks instead of really chasing after what I would consider to be quality coverage. Now, this is a term I did not make up. I've read this recently in some government reports as people are describing Advantage plans. So all these items here, these are actually called supplemental benefits. Supplemental benefits, okay? Things that original Medicare doesn't cover, right? But when they talk about the medical coverage, inpatient, outpatient care, here's what they say: low medical coverage. So my point is, a person has to decide how do they want their insurance to work if they got cancer, if they had some kind of a heart issue. And so yes, Advantage plans are full of all these kind of perks, but when it comes to the medical coverage, it's going to be low. And that's why people that will stay in traditional Medicare A and B and get some kind of a supplemental plan, yes, they're not going to have perks, all these benefits here, but what they are going to have is wonderful medical coverage. If Medicare pays, that supplemental plan is going to fill in those gaps. So again, this is why I said earlier when I opened up, in this scenario here, I have never had a single complaint whatsoever with someone's coverage when it comes to original Medicare with that supplemental plan. All right? And so the point is, you have to decide as a consumer, what are you going to chase after? Sure, these things are real attractive when you're healthy and 65, healthy and 66, but how about when you're 70, 75, maybe 80 years old, and now you're in this system here, and you have that low medical coverage, having to deal with the networks and the pre-authorizations and some of those limitations and restrictions that are placed on you by the Advantage plan. Hey, Medicare can be very confusing. In fact, people make mistakes all the time because of how confusing it is. So what I've done is I've actually created a Medicare, notice this, Essentials Workshop, where you have the opportunity to really learn everything that you need to know about Medicare so that you can make Medicare decisions. There are thousands of people every month that watch this workshop, and we get lots of reviews saying that this is something that really was helpful to them. And so what you can do is down here below in the comments section, you'll see where it says pinned comment. At the very top of those pinned comments is a link. And you click on that link, what we're going to do is we're going to give you free access to this Medicare Essentials Workshop. And we want you to watch it because we don't want you to make any mistakes. And then last and certainly not least is this very important consideration here, number 3, switching plans has become very difficult. That's what's led to a lot of the chaos in Medicare today. So here's the way the system works. October 15th through December the 7th, okay? This is when people can switch Advantage plans to Advantage plans, okay? And when they make that switch, October 15th, December 7th, there's no requirements whatsoever. As long as that Advantage plan is in your zip code, you can switch to that, all right? Another time we can do this is January 1 to March 31st, okay? And we can switch again, Advantage to Advantage. I can switch those plans. If I make the switch in January, my new plan starts February. Switch in February starts in March. March is going to start in April. Now up here, if I make this switch here, my new plan is always going to begin January the 1st. All right? So my whole point is this. We have opportunities where we can switch plans, Advantage to Advantage. But here's where the difficulty becomes. If someone is on an Advantage plan and they enrolled in that Advantage plan and they stay on that plan, let's say a year or 2 or 3 or 4 or 5, 6 years, maybe 10 years, and they stay on the Advantage, and then they would like to make this switch, Advantage to A and B with a supplemental plan, okay? Now, they can make that switch for sure to get off their Advantage and move to a supplemental plan, but now they have to go through underwriting, okay? Now, when I switch Advantage to Advantage, no underwriting. That Advantage plan, as long as it's in my zip code, I can get that plan. But if I want to make this switch, I've been on the Advantage plan for a while. Now, I have to go through underwriting. So what happens? We're going to have to ask you about 35 health questions. We're going to look at all your prescriptions that you're taking and see what you're being treated for now and in the last 24 months. And then we're probably going to need some kind of a statement from your doctor called an attending physician statement. And this information that we gather is going to be then given to the insurance company, underwriting and go through the underwriting process. And that supplemental plan now does not have to take you. They're not obligated in any way unless you live in New York, Connecticut, Maine, or Massachusetts. Those 4 states you can move. But everywhere else, unless those 4 states, again, New York, Connecticut, Maine, Massachusetts, if you want to switch from Advantage to a supplemental plan, now you're going to have to go through this process of underwriting. And so that insurance company does not have to take you. They absolutely can deny you. So if there's something in your health records they don't like, you're an insulin-dependent diabetic, you have rheumatoid arthritis, you have spinal stenosis, you have AFib, cancer in the last 36 months, sometimes 60 months. So there's health issues where the company says, no, we're not going to cover you. We're not going to take that policy. And then you're going to be stuck only in that Advantage system. And my point is this, a lot of consumers really don't realize that if they get in that Advantage system and stay in that, they may not ever be able to get out off that the rest of their life. Now the good news is when you first go on Medicare, whether that's at 65 or you retire at 67, and once you go on Medicare and you have that Medicare B, you have 6 months where you can get any Medicare supplemental plan you want. There's no underwriting whatsoever, but that 6 months is tied to your B day. So I'm shooting this video today. It's April the 11th, 2024. So let's say someone started their Medicare this month, 4/1/2024, and we'll just say this was their A and B date. But the B date's the key. They have 6 months. They can apply before their B begins so that their Medicare starts and their supplemental plan starts all at the same time, or they still have 6 months after their B begins where there's still no underwriting. So in this example, that'd be April, May, June, July, August, September, which means what? In my example, October 1, 2024, forever, if they ever want to get a supplemental plan, now they have to go through underwriting. The first 6 months, insurance companies have to take you. They can ask you no health questions. They have to cover all your pre-existing conditions. That's what we call your guaranteed issue period or your Medigap open enrollment period. So for those people that are unhealthy, have a lot of issues, they definitely better take advantage of that 6-month window. Okay, now, you don't have to be ready to run a marathon to get approved after the 6 months, but you do have to be generally healthy to get that supplemental plan. So it could be your once and only opportunity throughout your life to have that quality insurance called a supplemental plan. All right, so that's what's going on with Medicare. In my opinion, Medicare Advantage has taken over the market. We read that article, and that doctor felt the same way, and they really have bought the market. And so, yes, it looks really attractive to people who are healthy at 65, and yes, the insurance companies make lots of money, and the agents make lots more money as well, but you have to be convinced is that really the very best coverage for you, and ultimately, that's the decision. So what's happened with Medicare? I believe the Advantage companies have taken over. Originally, Medicare began to take care of patients. And now it's all about those insurance companies. It's all about their profits. And now many people are in that system and there's no way out.